Well, thank you, Chair Eshoo. I haven't been called wonderful for quite some time. And thank you, Ranking Member Guthrie, for holding this hearing. And thank you to the witnesses for appearing before us today to discuss the advantages of telehealth technologies during the COVID-19 pandemic and beyond. In rural districts like my Indiana 6th district, telehealth expansion during the pandemic has been a game changer. Countless Hoosiers have benefited from the convenience of services that remotely connect patients to doctors, specialists, and other healthcare professionals, all from the comfort of their own home. Throughout the pandemic, telehealth provided that it can provide high-quality, patient-centered care that, in many instances, mirrors the type of care received in person. Under President Trump's leadership, flexibility in telehealth services allowed physicians to stretch their resources to meet the diverse needs of disparate communities, quite often 2 hours away from healthcare, as mentioned earlier in the hearing today. In Indiana 6th District, 2 hospital systems received funding under the FCC's COVID-19 telehealth program to service patients' needs with innovative methods of care. Hancock Regional Hospital in Greenfield used these grants to develop a portable camera system for COVID-19 infected patients to connect with infectious disease experts located at neighboring hospital systems. Beyond the pandemic, the telehealth services will play a key role in addressing barriers to care for rural patients, especially those that suffer from mobility issues or patients with chronic conditions. It's important to recognize, however, that these services are rendered useless for Hoosiers and all Americans that sit on the wrong side of the digital divide, which covers a large portion of my district. Innovative models of care will not overcome inadequate internet connections. Further, as this committee develops solutions to the future development of telehealth technologies, we must remain cognizant of the challenges of wasteful spending and fraudulent claims that will strain an already bloated healthcare system. Dr. Mehrotra, I understand that there are certain conditions such as movement disorders which require in-person interactions to properly diagnose and treat. In your testimony, you also mentioned the limitation of telemedicine visits for things like ear infections for infants. This is especially difficult for patients in rural America with limited access to resources. Doctor, can you expand more on how we could blend telehealth services into traditional care to better impact rural America and patients with chronic health care conditions?
Well, thank you very much for the question, Representative Pence. And I might highlight something before I turn to your question directly. I do want to emphasize something you brought up earlier in your testimony when you discussed the health systems in your area using telemedicine. We are also seeing a lot of, in rural communities, telemedicine used in emergency departments to try to facilitate specialty care being provided within those communities. And the one thing I wanted to emphasize there that I am concerned about is while we have evidence that telemedicine use in emergency departments is effective, the smallest and most rural hospitals are the least likely to have that technology. And so there's a real barrier there. So how do we make sure that those hospitals have that technology? In regards to your question, more directly related to how do we incorporate telemedicine care into rural communities, I think one of the points that we've made earlier in the conversation is how do we allow patients in rural communities to access the care from anywhere else in the country. And I think we heard of the story of how in many cases patients in rural communities it's not someone within the state of Indiana, for example, but is in many states away. And so we talk a lot about licensure and being such a critical reform to try to allow patients in rural communities to access the care that they need.
Okay, thank you. And thank you for letting me come on, Madam Chair. I yield back.